I am Dr. TS Ravi, specialist physician working at Ahalia Hospital, Hamdan Street, Abu Dhabi. Today I am going to tell you about hypothyroidism. Every year, the month of January is celebrated as a thyroid month to create an awareness about thyroid disorders in the population. Hypothyroidism is the commonest thyroid disorder, so I am going to tell you a few words about hypothyroidism. What I mean by hypothyroidism is that there is a decreased secretion of thyroid hormones into the body, and there are two important thyroid hormones, T3 and T4. The thyroid hormones are very essential for the metabolism of every cell in the human body. There are several causes of hypothyroidism. The commonest is global iodine deficiency in the diet, and the second commonest cause is autoimmune disease of the thyroid called as Hashimoto's thyroiditis. Other causes for hypothyroidism: congenital abnormalities in the synthesis of thyroid hormones, if the patient is exposed to any irradiation or if he has undergone surgery on thyroid gland. Generally, 5% of the population is affected with hypothyroidism. The importance of hypothyroidism arises from the fact that if any woman becomes pregnant and develops hypothyroidism untreated will lead to severe complications both for the mother and for the child. I will tell you the clinical features of hypothyroidism. The commonest clinical feature is cold intolerant, where the patient cannot tolerate a cold, and patient also develops a weight gain and swelling of the legs, constipation and memory impairment, hearing impairment and heart failure and so on. So especially women, they present to us with menorrhagia. There is excessive bleeding during the menstrual periods, and they may also develop irregular periods, or there may be cessation of menses, what is called as amenorrhea. Diagnosis of hypothyroidism is pretty simple. We estimate three important hormones, the T3, T4 and the TSH. And how do we prevent hypothyroidism? If you are coming from an iodine deficient country, so we urge you to take iodized salt, and you have to avoid cruciferous vegetables like cabbage, cauliflower and broccoli. And all women before pregnancy should compulsorily undergo screening for hypothyroidism. So if you have any of the symptoms which I mentioned before, like cold intolerance, weight gain, constipation, dry coarse skin, easy fatigability, so we request you to kindly contact your physician to screen for hypothyroidism, and if found so, to begin treatment immediately. Thank you.